Hey, Dr. Drew here with Inspired Cosmetic Surgery. We're doing a follow-up for a double incision surgery. The patient had their surgery 5 days ago. I usually like to take the skin graft bolsters that hold the free nipple grafts down. I like to take them down and check the free nipple grafts at 5 days. So we're getting ready to do that. Our patient's been doing very well. They already had their first follow-up visit the day after surgery, which I like to check and make sure the patient doesn't have a hematoma or other problem. Now we're getting ready to take the bolsters down. So we're gonna take the bolsters down on our double incision breast surgery patient. So we have 2 bolsters on. We're gonna take the vest down, that's the compression vest, and then we're gonna start to remove the skin graft bolsters. So I'm just gonna move your arm here and unzip the vest. The drains are still in place. The drains stay as long as necessary in order to keep the output as low as possible. When the output gets to the right amount, then we'll actually remove the drains. This usually will turn from red to a straw or yellow clear color, and that is going to get us closer to the point of where we're going to remove the drains. We'll check this side to see this has already turned that yellow or straw color, and this is getting closer to the color that we're looking for when the drains come out. Generally, when this color gets straw yellow like this, then the output starts to decrease. When it decreases enough, we'll take the drain out. So we're going to get ready to take these bolsters down. The bolsters are basically, they look like flowers. They're sewn onto the free nipple grafts in order to hold the free nipple grafts in place and keep any fluid or drainage from floating them off of their bed. So we create a wound bed for them, put the graft in place, and we sew this bolster down in order to keep it intact and get a normal skin graft take. If the skin graft separates or floats up from fluid underneath it, then we could lose the graft and we'd have to reconstruct a new nipple. So we're getting ready to take these bolsters down now. Okay, so we're ready to take down these skin graft bolsters from a double incision chest surgery. So we're going to cut the sutures that hold the bolsters in place. We're going to get started with that right now. Doesn't really hurt to do this. It feels a little weird, but it's not super painful. So I'm just going to cut the sutures that are holding these down to the skin. They're actually sewn to the skin to hold these down. So you can see that the bolster is starting to come off because I've cut that suture. And there's another suture to cut here. And then the whole thing should release. So then I just grab one of the edges and just gently release this from the chest. And then we just kind of gently pry from edge to edge to make sure we're not accidentally lifting the skin graft off. There we go. You can see that coming up. You can see this looks nice and healthy. We tend to put the nipple areolar complex on in an oval because it tends to stretch out into a circle. All right, looks like 100% take. You can test that by just checking the stability of the graft, which looks great. And the purple around here is just skin graft marker for actually marking the location of the graft. So now these stitches all dissolve, but I'm going to take them out anyway. There we go. There we go. Pretty easy. So that's all out now. Now we're just going to keep ointment along the wound and around the nipple areolar graft and over the graft itself. That'll just be triple antibiotic ointment that we provide for the patient when we do the pre-op visit. So now we're going to go to the other side, take the other graft down. Getting ready to take down the left side skin graft bolster. We've already taken down the right side from this double incision female to male chest surgery. So we're just getting ready to remove the left skin graft bolster, which holds the skin graft down. Just going to flip this arm up for a second. This is one of the drains in place that's starting to clear its drainage. We're at day 5 after surgery. That's the time that I like to take the bolster down. The bolster is keeping the skin graft alive by putting pressure on the skin graft while it's trying to take. So this is actually sutured down to the skin. So I'm just cutting the sutures now, and that will release this bolster or this little flower that's tied on here to keep pressure on the graft. So I'm just releasing that. And I think I have most of the sutures cut now. So we just gently pry this away so we don't accidentally lift the skin graft off because it's still fragile. We do leave a little space for drainage in the graft. The purple that you see is just marking pen. We usually put the nipple on in an oval shape because it tends to stretch out and form a round shape. And then I'm just removing the sutures that held the bolster in place. Then we will take care of this by putting Neosporin over the graft, over the suture line, and over the incision. Everything's looking fantastic at this point. We took the skin graft bolsters down. There's 100% take of both skin grafts that you can see. They're nice and intact. Not much is going to disrupt them now, so we just need to be gentle with them. After we remove the bolsters, and then for the next 7 to 10 days, we're going to use triple antibiotic ointment or Neosporin type ointment to go around the graft and then over the graft. And it's normal for these to look a little bit raw. The stitches all dissolved that you see, and the stitches under here are all buried. And so we just need a thin, shiny coat of triple antibiotic ointment here. It shouldn't be gobbed on, but the wound should be maintained moist all the time. When they're kept moist, the healing is much better, and the healing is faster. So we do that to both sides, and we do that every 4 to 6 hours in order to keep the grafts and the wounds moist. We also want to keep a little non-stick dressing in the area to keep the grafts from sticking to the compression vest. And that's it. It should be a thin, shiny coat like that. So to dress these wounds, we've already got our very thin, shiny coat of ointment on that'll go on every 4 to 6 hours over this double incision surgery. And then the only thing that we need to do is keep a light dressing in place just to keep the ointment off of the garment and to keep things a little cleaner. So just an opened up light layer of gauze we can put over the wounds and then zip the vest back up. What we don't want is to remove these too fast so it pulls up the graft when they're being removed. So somebody should just lift this up very gently, and if it's sticking, just very slowly and carefully lift that off of the graft so it doesn't lift the graft off. And then we just need to zip the compression vest over the wounds. I do not like to use tape when I don't have to because it can cause a little bit of skin damage. Make sure the drains are off of the wound site and just zip the vest up. The dressings will stay intact.